So we have an expert to guide us in this aspect. Also, he will enlighten us as to how we should keep our children and how children should be, so that they take care of their health also and they do their studies also nicely, because nothing can be neglected, neither health nor studies. So without wasting much time, I hand over the stage to our principal sir. He might speak a few words, and then after we will give total time to Dr. Saab. Now my request is that only after he finishes his presentation, the students or parents or teachers, they can put up their queries. They can ask, and patiently he will answer everybody's query. Means don't make a competition over there. My first, no, be patient. All the questions will be answered. It might so happen that your question might be answered when others are asking questions. So be patient. In this type of meeting, patience is a must. So with this, I request Honorable Principal Sirs to please address everyone. Sir, please.
सबसे पहले तो डॉक्टर तिमिर बरन साहू जी, most welcome in this webinar of Kendriya Vidyalaya number 1, and I am very thankful to you that through your hospital you are doing something which is very much beneficial for our children. Next, I welcome all the parents especially and the children also. जो बच्चे यहाँ पर जुड़े हुए हैं, उनके माता पिता सभी का दिल से स्वागत है। इस कोरोना पैंडेमिक के टाइम में आपने भी विद्यालय का बहुत साथ दिया है, इसमें कोई दो राय नहीं है। और शर्मा सर इसको ऑर्गेनाइज कर रहे हैं, प्रफुल्ल इसको, अभी पूरा प्रोग्राम हमारा लाइव हो जाएगा थोड़े देर बाद ही, आप अगले दिन हम इसको अपलोड कर देंगे अपनी वेबसाइट उस पे, यूट्यूब पे, सब लोग देख पाएंगे।
लाइव है सर, लाइव है, बच्चे देख रहे हैं, एकदम लाइव है। हाँ,
ओके, तो द प्रोग्राम इज गोइंग ऑन लाइव, तो बहुत सारे लोग एक साथ जुड़ सकते हैं। और जो हमारा उद्देश्य है, डॉक्टर साहब का जो उद्देश्य है और जो हमारे टीचर्स का उद्देश्य है कि हमारी बात, स्पेशली हमारे एक्सपर्ट्स की बात सभी तक पहुंचे, वो होने जा रहा है। और ये एक अच्छा सेशन है, सभी लोग, आई होप सभी लोग इसको एंजॉय करेंगे। आपके क्वेश्चंस आप लिख दीजिएगा, वो क्वेश्चंस के जवाब डॉक्टर साहब देंगे। और उसके बाद भी अगर कोई समस्या आएगी तो हम डॉक्टर साहब से रिक्वेस्ट करेंगे कि एक बार स्कूल आकर के भी एक विजिट करें हमारे यहाँ, और हमें भी मौका दें अपना स्वागत करने का, क्योंकि यहाँ पर तो एक लिमिटेड क्राइटेरिया है। तो इन्हीं बातों के साथ मैं स्वागत करता हूँ डॉक्टर तिमिर का। और नाउ माइक हैंड ओवर टू अगेन शर्मा सर। थैंक यू।
थैंक यू सर। And now, without wasting time, I would invite Dr. Sahu to kindly start his session. Sir, please.
Yeah. Thank you, sir. A very good evening to all students, parents, and their respected teachers. The topic for today's discussion is what is the impact of COVID-19 and lockdown on the mental health of children and adolescents. So, in general, there is a sense of fear and anxiety regarding illnesses, regarding academic pursuits, and financial future. There is short-term as well as long-term psychosocial and mental health implications for both children and adolescents. The quality and magnitude of impact on minors is determined by factors like their developmental age, their educational status, their pre-existing mental health condition, being economically underprivileged, or being quarantined due to infection or fear of infection. We'll be taking up all of these point by point in the session. First of all, let us discuss what is the impact of COVID-19 on young children. In young children and adolescents, the pandemic and lockdown have had a greater impact on emotional and social development compared to that in grown-ups. So younger children, that is 3 to 6-year-olds, are more likely to manifest symptoms of clinginess. That is, they cling to their parents, they fear that they may be separated, and there is also the fear of family members being infected. And this is more in younger children when we compare that to older children, that is 6 to 18-year-olds. Older children were more likely to experience inattention and were persistently inquiring regarding COVID-19. When we say inattention, because now there is social distancing, children are unable to meet their friends, unable to meet other people, unable to go to school, so they feel that they are not being attended to. There is a sense of isolation and loneliness, and that is bothering the older children more. Children feel uncertain, fearful, and isolated during the current time. They also experience disturbed sleep, nightmares, poor appetite, agitation, inattention, and separation related anxieties. And what is the impact on school going and college going students? First of all, the home confinement of children, this has led to a disruption in their education, in their physical activities and opportunities for socialization, which in turn has led to uncertainty and anxiety. The absence of a structured setting of the school for a long duration results in a disruption of routine, boredom, and lack of innovative ideas for engaging in various academic and extracurricular activities. Children are not being able to play outdoors, they are not able to meet friends, and they are not able to engage in the in-person school activities. As a result, these children have become more clingy, attention-seeking, and more dependent on their parents. Now, this is the interesting part. It is presumed that children might resist going to school after the lockdown gets over, and they may face difficulties in establishing rapport with their mentors after the schools reopen. Consequently, the constraint of movement imposed on them can have a long-term negative effect on their overall psychological well-being. We may already have observed that with children increasingly engaged in activities in the digital with digital instruments like tabs and mobiles and all, their willingness to go out and meet their friends and to engage in physical activities has already gone down. So the rigid schedule which will be required once school open, so children may face some difficulties in going back to their normal routine. Older children and youth, they are anxious regarding cancellation of examinations, regarding exchange programs and academic events. In short, there is a general sense of uncertainty around their future. Further, due to prolonged confinement at home, children increased use of internet and social media predisposes them to use internet compulsively and access objectionable content, and also increases their vulnerability for getting bullied or abused online. There is a special some children who need special care, and the impact is more in such children. They may be both children and adolescents both. And there are one in about every 6 children within the age group of 2 to 8 years who have some or the other neurodevelopmental, behavioral, or emotional difficulties. These children with special needs like autism, attention deficit hyperactivity disorder, cerebral palsy, learning disability, developmental delays, and other behavioral and emotional difficulties, they encounter challenges during the current pandemic and lockdown. With children with special needs, the bottom line of their having a normal life is their routine. Now, with this pandemic and the lockdown, their routine has been totally disturbed. And these children, they have an intolerance for uncertainty. And there is an aggravation in the symptoms due to the enforced restrictions and unfriendly environment, which does not correspond with their regular routine. Also, they face difficulties in following instructions, understanding the complexity of the pandemic situation, and doing their own work independently. This category of children, those with special needs, they have suffered a lot during this pandemic and lockdown. They have been unable, those children even who were on track to grow normally, that is, whose language was developing, whose socializing skills were developing, all that has suddenly been brought to a halt. And so the condition of many of these children has actually deteriorated during this pandemic. Another category which needs special mention is underprivileged children. The social inequality has always been associated with the risk of developing mental health challenges. And the pandemic and the lockdown, and the world has experienced a global economic turndown, which has directly worsened the pre-existing social inequality. A home represents a source of security and safety in most families. However, for the poor and the unprivileged, it is just the opposite. With the restriction of movement due to lockdown, these children have increased risk of being exploited and they become victims of violence and abuse. Our children helpline number 1098 that has registered a lot of almost a 50% increase in the number of calls that they have received regarding children being abused and violence being used against children. So this is another special category of children who have suffered a lot during this lockdown. So we come to the main part, the crux of today's talk, that what is the role of parents. In times of paramount stress and uncertainty, a secure family environment which the parents can provide is a strong protective factor. So parental practices and coping measures, they affect the children's post-disaster mental health. So parents need to respond to the needs of their children based on the developmental phase of the child. When we say developmental phase of the child, that we are in a common language, we would say it depends on the age of the child. A younger children may have different needs, and adolescent may have different needs. A youth may have still other needs. So healthy parenting would involve engaging in interactive play activities, practicing mental health hygiene, maintain a consistent routine, promoting healthy behavior, practicing healthy communication, displaying good coping mechanism, and being positive role models. We'll discuss all this point by point. So, for those parents who have got young children, the first thing their children demand is more attention. These young children, they need their parents' physical presence and they need to engage in more indoor play related activities with them. So parents should devote time to provide the child with undivided positive attention and reassurance. The child should get the message that whatever may happen, but the parent will always be there with them. Second point, we have to increase the children's awareness regarding COVID-19 in an age appropriate manner. We must offer them the information which they can comprehend and understand depending on their age. Third point, we have to alleviate the anxiety of children regarding the current uncertain situation. This point is very important, that children's exposure to news should be limited and it should be through fact-based neutral news channels only. Tabloid news, sensationalism, which is seen largely in TV news channels, all this children should not be exposed to all this. So we should depend only on reliable news. A fear mongering which is there in the society today, that we have to avoid. The fourth is that we have to model appropriate preventive measures and coping mechanisms which with the family as a team and children individually they are motivated to follow. A consistent routine is followed by the child with enough opportunities to play, read, rest and engage in physical activity. As mentioned earlier, in all children it is the routine which is the backbone of their mental health. And the main issue with this pandemic has been and the lockdown has been that the routine has been disturbed. So we have to develop a new routine and in which we have give them enough time to, like I mentioned, play, read, rest and engage in physical activity. It is recommended that families plays board games and engage in indoor sports activity with the child to avoid longer duration of video games. Parents should ensure that particularly the bedtime of the child is consistent. Now, one point which I would like to make is when the children not being allowed to go outside and meet their friends, it is the parents who are the only friends of the child. So we have to engage with the children, we have to play with them in indoor sports activities like board games and all. And exposure to and video games, that has to be reduced. We all are observing that children are now, everybody has got some kind of a tablet or a mobile phone in their hand and they are playing video games all the time. So that interaction with another person which happens during sports, whether indoor or outdoor, that is totally lost. So we have to discourage children from going too much for video games. Last point which I had mentioned was that the bedtime of a child should be kept consistent. This is another method of ensuring that screen time is limited. Many times you might have observed that children see their mobile or the tablet late into the night and so their sleep pattern gets disturbed. So parents must ensure that the bedtimes are very strictly enforced. Focus should be on good behavior rather than bad behavior of a child. Parents must tell more about options regarding what to do rather than what not to do. Like we can tell them that you can read books or I can read books to you. I can read stories to you. We can play games together. These are the options, healthy options that we may offer to the child to prevent boredom. And we must provide more praise and social reinforcement to children compared to material reinforcements. A word of praise or a slight pat on the back, a good word that goes a long way in maintaining the mental health of a child. Rather than material reinforcements like I will buy you something, a good word from a parent means much more to a child. The second category of parents that we will discuss are those with grown-up children or adolescents. We must remember that parents are the best role model for children, and home is practically the best place to learn all the life skills. Hence, this is the best time for parents to model the most important life skills like how to cope with stress, how to cope with emotions, and how to solve problems. Due to the cancellation of exams and handling disappointments and uncertainties, it all becomes very difficult. So parents have to train their children how to handle all this in a positive manner. For each disappointment and uncertainty, there should be an alternative. Moreover, to inculcate a sense of control in adolescents whenever possible, parents can include adolescents in the decision-making process, especially in matters related to them, like what kind of courses they would like to follow in the future, where would they like to go once this pandemic is over. Anything related to adolescents, we must take their opinion also into consideration. Now, adolescents are expected to have a better knowledge about COVID-19 compared to younger children. Therefore, communication has to be more open and non-directive. On the other hand, judgmental statements about adolescents should be avoided. This is a very crucial period of life in which we have to restrain ourselves from passing any judgments on our children, because we must understand that they are also going through a fluid stage and their thinking process has not crystallized. So it is suggested that whenever we talk to our children, when they are slightly grown up adolescents, so we must be non-judgmental in our approach. Another cause of concern is excessive internet use. For example, internet surfing related to COVID-19 should be avoided as it results in anxiety. This is similar to being exposed to too much of negative news on TV. Excessive and irresponsible use of social media or internet grade gaming should be cautioned against. Now, like you mentioned, with children being restricted indoors and everybody having some kind of a digital device in their hand, it has become very easy for children to engage with other people on social media. So we must restrict their timing, of course, with their consent only. So negotiations with adolescents to limit their time and internet-based activities are recommended. And more non-gadget related indoor activities and games are to be encouraged, just as in younger children. Another outlet for their creative energies would be taking up creative pursuits like art, music, dance, and others. They can also help manage mental health and well-being for everyone. Inculcating self-driven reading by making them select books of their choice and discussing with them helps in adolescent development. Adolescence is a phase of enthusiasm and risk-taking. Hence, some of our children may feel invincible and try not to follow guidelines related to distancing and personal hygiene. This has to be addressed with adolescents assertively. One more thing that parents of adolescent children must keep in mind is that they must value the peer support system of the adolescent, their friend group. Parents must respect the friends of their children. So parents should encourage adolescents who are introverts to keep in touch with their peers and communicate with them about their feelings and common problems that they face. This may also lead a way for appropriate problem solving. Finally, parents should take care of their own mental health also and try to cope with anxiety adaptively by meditation, progressive relaxation, physical activity, creative pursuits, and socializing over internet or phone with friends and relatives. To conclude, there is a pressing need to cater to the psychosocial and mental health needs of vulnerable children and adolescents during pandemic as well as post-pandemic period. Easy health access to mental health support services geared towards providing measures for developing healthy coping mechanisms are required. So we need a multi-pronged approach where psychiatrists, psychologists, pediatricians, community health workers, they all come together to help the family and the child to develop better coping mechanisms. So I would like to end my discussion here itself. Thank you all for your time. Thank you.
सर माइक्रोफोन आपका हमें
Thank you, Dr. Sahu. for giving an illustrious, you can say, knowledge to us, especially the specialist. From specialist point of view, we have gained a lot from your conversation.
Thank you, sir.
Now, may I now request all the participants, the listeners, to ask questions one by one. You can ask, put up your questions. We will handle it. We will try to focus on it. We will try to extend it to Dr. Sahu. So y'all, it is time for you all to ask questions. So please ask whatever is there in your mind. Is anybody asking, Praful sir?
No, sir.
No. Okay. Okay, I would begin. I would like to begin. Sir, you told that yes, during this time, we parents should be very soft spoken to the student, to the children. I do agree. But when we take classes, then we find that yes, there is a little disturbance from the student side. May it be their childishness. So how to cope up with this? In that scenario, if we don't use a little harsh words, strict words, then the student keeps disturbing the class. So how should we manage that? You being an expert, kindly throw some light on that.
Sir, we almost realize that these are very stressful times for children also. Like you said, they may not like to sit in one place for so long and restrict themselves to one place, and they may not be so keen to follow the rule, because even though you can see them on the screen, but your physical presence is not there, so they may feel a little bit on the naughtier side. So we have to have a balance between enforcing discipline and being kind and gentle with the children. So what I would suggest is we can talk to the children in a slightly firm voice, maybe not reprimand them, but maybe in a little bit firm voice. And if the child continues to disturb the class in multiple sessions, then maybe a little bit of discussion with the parent might help.
Thank you, sir. Thank you very much. Generally, we adopt this method only. And what about that energy level? We find that the students are very lethargic. I do agree. It is very natural. Even we adults, many a times, we find that it seems as if there is no energy in us. We are unable to cope up with our work only. Suppose correction is there or preparing the lesson is there. So we expect that children also might be facing the same thing. So what should they include in their diet and in their daily routine so that they will be active and the education does not suffer?
Yes, sir. Not only from the point of view of pandemic, but in general also, it is always a healthy diet, which forms the basis of all energy. So if we are taking a more sugar-rich or a fat-rich diet, then obviously our energy levels will be on the lower side. So we must encourage parents to offer their children healthy substitutes to junk food. Like a glass of fruit juice is much better than maybe, let's say, something tastier like a pizza. But that would keep the energy levels high, and the children can also feel more energetic during the class.
Yes, I would call the attention of especially working parents, working mothers,
Yes, sir.
where both the parents are working. So generally they compromise on the diet of children.
Yes, sir. Yes,
What
sir.
they do, they give them samosas or badas or you can say this pizza or something like this, and then they think that yes, they have done their work. So better it is that keep a stock of fruits in your fridge.
Yes, sir.
That would be better than this pizza and all those things.
Yes.
And the children also will be healthy and
Healthier.
their concentration will be more in studies. And you also take care of your health. Unnecessary thing, oily thing, fatty thing should not be consumed. So doctor, now I think doctor is speaking, so I think everybody will pay attention to it. When we used to speak or when we speak, people think that no, teachers are just saying whatever bookish is there.
Yes,
But
sir.
now a practicing doctor, a senior consultant is speaking. So now I think every parent, every child must pay attention to it. Avoid sugar rich food and fat rich food. Go for vegetables and fruits. This is what sir said. Now I request my colleagues who are there to ask whatever problems they are facing, and students also, please think of what you should ask. It's the best time, an expert is there, you can clarify your doubts. Later we won't be able to clarify all your doubts, so please, all of y'all.
Sir, good evening, doctor.
Good evening.
Good evening. I want to ask something, sir. How to encourage our children to eat fruits, sir? Because that is
Fruits and vegetables,
though
yeah,
they are
that is
eating them, they are not eating, so they are not consuming them.
What I tell all my parents is, all my that a child will never be able to buy a packet of chips by himself. It is we who offer the child the money and the facility to buy the chips. If we do not keep junk food in our house, if we keep fresh fruits only in our house, then the child will go for the fresh fruits only. It is when easier options are available, then the child will deviate to those. So what I would suggest is we keep this kind of chips and junk food away from our house.
Sure, sir. But still, I find, sir, they don't take interest. They are ready to be without the junk food, but not to.
Persisting maybe over a period of time. I think they might develop the good habit. They might develop taste in fruits and all, hopefully, and they may realize that junk food are only for maybe for weekends, not for daily basis.
Sir, thank you, sir.
and that physical exercise,
Yes,
that
sir.
also children generally they wake up late.
They wake up.
We have a lot of difficulty in telling them to attend the class on time, and we understand that parents are also pampering the children. They let the children be on bed for a very long time.
Yes, sir.
Now what is the solution for this?
Sir, like I mentioned, strict to bedtime routines. That is the where it begins. Because parents are also at home. Everybody is seeing mobile till late at night. Nobody is sleeping before midnight nowadays because the regular school hours are not there. So most parents and children, they are all sleeping after midnight only. So it is very difficult kind of for children to wake up early in the morning. So if parents can be encouraged to sleep a bit early, because we are not only talking about the health of the children, we are talking about the health of the parents also. It is not good for anybody to stay awake till very late. So it is a chance for both the parents and the children to get their health back in order. That is what I would suggest.
Thank you. It is really a help to us. You don't know how much you are helping us, because I will tell you an example. A student answers my homework at 2 a.m.
Yes, sir.
So then I'm bent upon saying that, see, child, don't keep yourself awake till
Okay.
night. But nobody listens to us. No, we are teachers. But
Yes,
when
sir.
a doctor is saying, then I think everybody must pay attention to this, whatever a doctor is saying, and that also a child specialist.
Sir, I would like to add
Now,
to this.
sir.
Like sir, what the body physiology is such that all kind of repair processes, it takes place during sleep hours only. The body heals itself during sleep, both physically and mentally. So during this pandemic period, when the immunity of the body is our foremost priority, when we must keep ourselves fit, then the first point of being fit is to have regular sleep hours. So if we want to not get infected with corona, if we want to stay healthy throughout this period, it is very important that we take our sleep on time and enough hours of sleep for everybody.
So I think now it is crystal clear to everybody that more than exercise, rest, and that also at correct time.
That's correct time, sir. Yes, sir.
That and this should become a routine. Like go to bed at 10 o'clock, wake up at 5 o'clock.
Whatever
This is the best ideal time. So all the students who are listening, please now pay attention. Don't let your health or don't spoil your health. And same way, if you are healthy, your academics will be healthy.
Yes, sir.
So anybody else would like to ask any question? On YouTube, is it coming, Praful sir? Are any questions coming on the YouTube? Please see and inform the doctor.
ओके मैं भी एक सवाल पूछना चाहता हूँ
Sir, sir.
जी सर, जी सर,
सर एक्चुअली हमारे यहाँ पे हर बैकग्राउंड के बच्चे हैं,
जी सर,
बैकग्राउंड के बच्चे भी हैं जिनके पेरेंट्स उनको हर तरह की सुविधा मुहैया करा पाते हैं. ऑल काइंड ऑफ facilities is being provided by the parents, and we have the parents who have nothing, what we say, to give facility at home to children. In that case, only children are coming to school. Sometimes parents are in the educational level, we can say they are illiterate. Sometimes, not all the time. Suppose RT admission is going on, and the father is dealing with the auto rickshaw, and mother is at home. She is a housewife. And sometimes what happened, early education system will know well. In that situation, उन पेरेंट्स को हम कैसे बताएं कि आप अपने बच्चे का ध्यान किस तरह से रखें, क्योंकि ये तो हम जानते हैं कि जो पढ़े लिखे पेरेंट्स हैं वो अगर हम आप नहीं भी मिलेंगे तो वो यूट्यूब से और डॉक्टर से कंसल्ट करके और काफी तरीके से वो अपने बच्चे को हेल्प पहुंचाते हैं. लेकिन वो पेरेंट्स जिनके पास कोई सुविधा नहीं है, जिनकी सुविधा का आधार हम ही है, हम उन पेरेंट्स तक अपनी बात कैसे ले जाएं और उनको किस तरह से समझाएं, क्योंकि उनकी डेली लाइफ स्टाइल में कई सारी चीजें ऐसी होती हैं जो बच्चे के लिए नुकसानदायक होती हैं. लेकिन वो पेरेंट्स बहुत साइकोलॉजिकली स्ट्रांग नहीं होते, ना वो उन चीजों को समझ पाते हैं कि बच्चे पर इसका इम्पैक्ट कैसे आता है. तो ऐसे बच्चों के साथ किस तरह से हम लोगों को करना चाहिए और उन पेरेंट्स को बेनिफिट कैसे.
जी सर. सर सबसे पहले मैं आपको बताना चाहूंगा कि मैं खुद केवी का प्रोडक्ट हूँ, राइट फ्रॉम क्लास 1 to 12. तो आई नो द केंद्रीय विद्यालय सिस्टम वेरी वेल सर. So and I appreciate that. I have appreciated the केंद्रीय विद्यालय सिस्टम. Anyway sir, coming back to the point that कि अगर पेरेंट्स बहुत एजुकेटेड नहीं हैं तो हम उनको कैसे ये सब समझाएं. तो सर कुछ चीजों के लिए जो हम कहें कि अगर वो एजुकेटेड नहीं है लेकिन अगर सिर्फ इतना विलिंगनेस है कि सामने वाले का बात को ध्यान से सुन पाने का और कुछ हद तक मान पाए, तो हम इन चीजों को बहुत हद तक हम सिंप्लीफाई कर सकते हैं. हम ज्यादा डिटेल्स में ना जाके अगर हम सिर्फ मोटी मोटी कुछ बातें भी, जैसे कि मैंने कहा नींद की बात, कि हम समय पर सोएं और समय पर उठें, इसके लिए हर कोई इवन हर आदमी जानता है कि यही अच्छा है उसके लिए. मे बी वो अभी फॉलो नहीं कर रहा है लेकिन यही उसके लिए अच्छा है. या जंक फूड वाली बात जैसे हुई, तो हम सब जानते हैं कि अच्छा क्या है, बस बात हमें उस पर फोकस करने की है कि इस दौरान जब हमें अपने मानसिक और शारीरिक मतलब तौर पर अपने को तंदुरुस्त रखने की सबसे ज्यादा जरूरत है, तो हमें फोकस वहीं पे रखना चाहिए. रही बात जैसे कि आपने कहा सर कि मतलब फाइनेंशियल इश्यूज भी होते हैं जो कि कुछ पेरेंट्स के साथ जुड़े हुए हैं, तो इसमें सर बच्चा सफर करता है, इसमें कोई शक नहीं है कि बच्चा सफर करता है. जैसे इस दौरान पैंडेमिक के दौरान लोगों के आमदनी में बहुत फर्क पड़ा है और ये घर का माहौल बिगड़ता है, बच्चा उसको देखता है माहौल को बिगड़ते हुए और उसको वो कई बार आत्मसात भी करता है कि ऐसा रहा था. फ्यूचर में भी उसके रिपरकशंस हमें देखने मिलते हैं. इसमें पेरेंट्स को जहां तक हो सके जो समस्या है वो तो अपनी जगह पर है ही है. ये एक तरह से आप यहीं पे जो बात आती है कि मतलब अपने को मन को शांत रखने की, जो कि मैं कुछ कहा जो मैंने कि जैसे आप उसे फिजिकल एक्टिविटी कहें, उसे आप मेडिटेशन कहें, उसे प्रोग्रेसिव रिलैक्सेशन कहें, उसे भगवान में ध्यान लगाना भी आप कह सकते हैं. लेकिन कुछ भी करके लेकिन हम अपने मानसिक स्वास्थ्य को ठीक रखें, क्योंकि ये समस्या आज नहीं तो कल जाएगी और हम वापस अपने जिंदगी को फिर से पाएंगे. तो तब तक हमें थोड़ा धैर्य ही रखना होगा. वो हम अपने स्तर पर मेडिटेशन के जरिए रखें या हम भगवान में ध्यान लगा के रखें, लेकिन धैर्य तो रखना होगा इसमें.
ठीक है, थैंक यू सर, थैंक यू वेरी मच. और इसी प्लेटफॉर्म से ऑन बिहाफ ऑफ यू मैं अपने सारे पेरेंट्स जो इस तरह की कोई प्रॉब्लम फेस कर रहे हैं, जो बच्चे की वजह से उनके कंट्रोल में नहीं आ रही है, मैं रिक्वेस्ट करूंगा आप विद्यालय आकर के अपने सारे टीचर्स से बात करें. और अगर इस तरह की कोई समस्या है तो विद्यालय परिवार आपके साथ पूरी तरह से खड़ा है. थैंक यू सर, थैंक यू.
Anybody else? Or shall we wind up because it's time? Sir has given a lot of time to us. कुछ आ रहा है प्रफुल्ल सर?
No, sir.
Okay, then let us wind up. And I'm really indebted to Dr. Sahu for sparing his valuable time with us and informing us in detail, presenting everything. So all the teachers and students have been benefited. This video will be on YouTube. Students can watch it later also as per their convenience. No issue at all. So I thank Principal Sir, I thank Mr. Prafull, I thank all the teachers, and a very big thanks to Dr. Sahu. Let us meet again. Thank you very much, sir.
Thank you, doctor.
Thank you, doctor. Thank you, sir.
Thank you, sir.
Thank you.
प्रफुल्ल सर एंड करेंगे.
Thanks, all of you.